You ever find yourself watching a medical show, maybe munching on some popcorn, and you just have to wonder, come on, would that really happen? Well, today we are putting a show to the test. We're going to break down scenes from HBO's The Pit with two actual doctors, a pediatrician and an OBGYN, who are watching it for the very first time. We're getting their expert take. All right, let's get into it. Right off the bat, the show just drops us into the pure chaos of pediatrics with this line. I mean, who can't relate to that? It's the perfect way to set the scene for the super high-stress world of an emergency department, which is exactly where we find our first case. So, who's giving us the lowdown today? Meet Dr. Kurt Bjorkman, a board-certified pediatrician, and Dr. Sarah Bjorkman, a board-certified OB/GYN. Now, they've never seen this show before, so what we're getting here are their totally raw, unfiltered reactions to the medicine, the drama, and, the real human stuff they see on screen. All right, let's open our first case file. This is a scenario that feels like it was ripped straight from a primetime drama playbook, an abandoned baby. So let's see how the show handles a situation that's this sensitive and this complex. Okay, so the scene kicks off with a nurse interrupting a doctor. And right away, our experts perked up saying that in a real hospital, that's a huge deal. If a nurse comes in looking for you, you stop what you're doing and you listen. So they find a baby all alone in a bathroom. The big question is, what do they do next? And this is where we see the first big clash between TV drama and real life. On the show, you hear this announcement over the loudspeaker. Is anyone missing a baby? Our doctors were like, whoa, no way. That would never happen. In reality, a hospital would use a specific, discrete code, something like a code pink, to alert the staff. Why? So you don't create a situation where literally anyone could just walk up and falsely claim that child. See, real life is all about security and protocol, not a big public spectacle. But here's where the show really nails the human side of the story. There's a nurse character who tries to give the parent the benefit of the doubt, and our doctors completely agreed. Parental burnout is so real. It's something they talk about with new parents all the time. It is absolutely okay to put your baby down in a safe place, like their crib, and just take 5 minutes for yourself. But leaving a baby in an ER bathroom, that crosses a very serious line. Okay, so the initial setup was maybe a little dramatic for TV. But what about the actual medical stuff they show? Let's take a closer look and see if the procedures are accurate. So the TV doctors start talking about doing a full workup on the baby, and that includes something called a lumbar puncture, or an LP. Now, this is a pretty big deal. It's an invasive procedure where they insert a large needle into the spine to check for really serious infections like meningitis. But our expert, Dr. Kurt, pointed out that while this used to be pretty standard, we have so much more data and better testing now. So it's actually done way less frequently today, especially if the baby seems otherwise healthy. And get this, there's a fantastic little piece of real-world medical culture here. When you do a perfect lumbar puncture and the spinal fluid comes out totally crystal clear with zero blood in it, it has a nickname. They call it a champagne tap because of the color. It's such a clean success that when Dr. Kurt did his first one, his chief resident actually bought him a bottle of champagne to celebrate. How cool is that? It just adds a bit of humanity to a really serious procedure. All right, the next medical hurdle they face on the show is getting a clean urine sample to check for UTI. And this is a super common and surprisingly tricky problem in pediatrics. I mean, how do you do it when your patient can't exactly, follow directions? So, our experts laid out the three main options. The catheter is usually the go-to for a sample you know is sterile. The bag method is way simpler, but the risk of contamination is really high. And then there's the suprapubic tap. Yep, that's a needle straight into the bladder. Now, it sounds super intense, but Dr. Kurt pointed out it can actually be less invasive and even safer than a catheter. But it's rarely done because, let's be honest, it just feels way more dramatic to worried parents. But then the show introduces a clever fourth method, using cold gauze to stimulate the baby to pee. And this got a huge thumbs up for realism. Dr. Kurt even shared his own ProDad hack that uses the same idea. Right before he opens a diaper, he'll slip a cold wipe just inside the top. That cold reflex makes the baby pee one last time, and it saves him from getting sprayed. It's a trick that totally works, both on TV and in real life. Okay, let's move on to our second case. This is something that I'm pretty sure is a nightmare for a lot of parents. A kid who decided their nose was the absolute perfect storage unit for some beads. So to solve this very specific problem, the TV doctor pulls out a device called a CATS extractor. The idea is to slide it past the bead, inflate a tiny little balloon behind it, and then just pull the bead right out. On screen, it looks like a really slick, simple solution. But are real doctors watching this? Oh, they had a very different reaction. Dr. Kurt said it straight up gave him anxiety. And why? Because the doctor on the show is basically going in blind, without good lighting or any tools to open up the nostril. He called it blind fishing, and that is absolutely not something you want to be doing inside a child's airway. So here's what would actually happen. A real doctor would call an ENT specialist, an ear, nose, and throat doctor who has the right equipment. We're talking proper lighting, speculums to see exactly what they're doing, the whole shebang. The way they do it on TV risks making everything way worse by pushing the bead further back, maybe even into the airway. It's a classic case of TV picking a fast, dramatic fix over a safe, careful procedure. But the show got one thing absolutely 100% right, the human element. The doctor uses a video game to distract the little kid, and he calmly talks the worried dad through the whole thing. And that is a huge part of pediatric medicine. Real hospitals have child life specialists whose whole job is to distract and comfort kids. So the show's portrayal of that technique, totally spot on. And as our doctors were reflecting on this scene, we got this really beautiful insight into the journey of being a parent. The stress of being in the ER because your kid put beads up their nose is just one tiny moment in this long emotional journey where, as Dr. Kurt put it, the heart is going to change, the joy will grow. So, after looking at these two very different cases, what is the final diagnosis from our doctors on the medical realism of HBO's The Pitt? Let's break down the report card. For character personalities, it gets an A. Dr. Kurt said, quote, "I've met all of these characters in real life." For the medical procedures, it's a B-. Some clever, realistic tricks, but also some shortcuts that definitely made our real doctors nervous. But where the show really truly shines is in capturing the humanity of medicine. For that, it gets an A+. But even with those high marks for humanity, our doctors felt that one major piece of that puzzle was missing from the picture pretty consistently: the nurses. They're basically invisible, and they are the absolute backbone of any real hospital. And this might be the most important takeaway of all. Medical dramas love to focus on the doctors. But in real life, medicine is a team sport. Like our doctor said, the nurses are the ones at the bedside. They know the patients inside and out, and they are the ones who truly keep things moving. You always, always treat your nurses well. Ultimately, this all brings us to one final question. This show gets some procedures right and some wrong, but it totally excels at capturing the human drama. And it makes you wonder, what are we really tuning in for? Is it the thrill of the medical mystery? Or is it the deeply human stories of the people right at the heart of it all?